people in the state have been charged with violating the state's stay-at-home order. Those charged could face a fine of up to $1,000 and 90 days in jail. Governor Walz says he's encouraging education over charges, except in extreme cases. Governor Walz is now giving his update via phone. Let's listen in live.
In each, just to ensure we can get through as many questions from as many outlets as possible, and we will allow for a single on-topic follow-up. And with that, I will turn it over to Governor Tim Walz.
Thank you, Teddy. Good afternoon, Minnesotans, and good afternoon, everyone who's on the call today. I appreciate, again, the collaboration to get out as much information as we can to Minnesotans. And sometimes it is a bit overwhelming. I want to take just a moment to talk a little bit about what we did yesterday in terms of an extension of the peacetime emergency. If folks recall, it seems much longer than this, but it was a month ago on March 13th that I signed the executive order that created the peacetime emergency. That's not that in fact, it's a very common thing that governors do, and in Minnesota, governors do that for everything from flooding to tornadoes to anything that might involve using the National Guard. It opens up certain tools, as we've talked about in the toolbox. If it extends beyond 5 days, the law states that you go to the Executive Council, and the Executive Council is created by all the constitutional offices, myself, the Lieutenant Governor, the Attorney General, the Secretary of State, and the Auditor's Office. And then a vote is taken there, and a majority vote is what it takes. At that point in time, the legislature can, by a majority vote in both houses, the House and the Senate, overturn that. There's nothing in Minnesota statute that's very vague that goes beyond the 30 days. So we are interpreting that in the most conservative manner, and it does not state in statute that it needed to be approved by the Executive Council. We did that. Also, though, that sets up the ability of the Senate and the House to overturn that peacetime emergency should they choose to do so. That is the model that we will take going forward. Our hope and our planning is that we do not have to do that very much longer, but should we, and should the legislature not be in session, we would call them back into session so that they would have the capacity to overturn that should they so wish. That is different than the stay-at-home executive order that we extended to May 4th. So some of the confusion around that was the stay-home makes acts for, except for essential travel, pharmacies, grocery stores, the things we're doing, and folks who are working in those essential businesses, and as we open up more of those. So if there was any confusion, there was not an extension of the stay-at-home order to May 13th. That was the emergency, the peacetime emergency. The peacetime emergency allowed us to enhance veterans' home protection, activated the National Guard to deliver supplies, preserved our personal protective equipment, and allowed some regulatory changes, especially the licensing boards, to make sure that people could continue to use their CDL, could continue to practice in their professions. So those were moves that were taken, and we'll move from there. I just want to make sure we clarified that. I spent the morning speaking to the entire federal delegation. Was on a call this morning. I want to thank the senators and the members of Congress, the House of Representatives, incredibly engaged, incredibly helpful, let us get some insight into where the next potential help will come on COVID-19 and what can be done in the midterm. They also brought up good questions to help us assist together. One of the members got contact information for their constituents should they be one of the folks that maybe are having trouble through navigating one of the state systems, UI or whatever it might be. Another member brought up a very valid point, and Commissioner Malcolm often reminds people of this, the danger of people not going in to see a doctor when they need to because they are concerned even about COVID-19 or they're concerned about using PPE. And I think we need to remind people, if you need to see a doctor, you need to see a doctor. And I think that was a very good point. And they also asked how they can continue to advocate for the things that will make us this transition back to our employment, back to keeping people safe, and the ability to be able to test and trace accordingly. Obviously, today we're watching the legislature here in Minnesota very closely. They're moving a package of things through. I believe as we're speaking now, the Senate is coming back in. But this morning there were some really good things that are moving, especially allowing us to purchase some milk for hunger organizations. Also ensures anyone who's uninsured to be able, for Minnesota, coverage on COVID-19 testing and office visits up to 100% of federal reimbursement. Legislation clarifies telephone visits, just a lot of things that needed to be cleaned up on this. Legislature and the agencies work together, making sure that they can come back safely and efficiently and move some of these things, and I'm really pleased about that. And then again, proving that we can do many things at one time. The House passed the Alex Smith Insulin Affordability Act. This was a compromise. I think many of you listeners today know that this is something we've been trying to get done for quite some time, years as a matter of fact, and it looks like today that will happen. So I'm certainly grateful for that. I would mention that we are watching the weather closely, not just the storm squalls of here, but the high water marks and the river gauges up in Oslo and Marshall County on Highway 1 up there that's flooded. We've got National Guard up there working. The good news is again, flood stage is 37.5 feet up there. It is now down to 37.68, and at the current rate, we should be able to disengage our National Guard by Friday or Saturday when it gets below 37 and the highway's back open again. So Joe Kelly and his folks over there are running multiple missions at the same time, but the state has the capacity certainly to do that. With that, I'd like to turn it over to Commissioner Malcolm to update the situation.
Thank you, Governor. Good afternoon. I'll start with the global and national update. The global total as of early this morning was more than 1.9 million cases and over 120,000 deaths around the globe. In the United States, we now have over 582,000 confirmed cases, over 196,000 in the state of New York, and over 106,000 in New York City alone. The United States is now reporting 23,649 deaths, 7,349 in New York City alone. Here in Minnesota, we have today a total of 1,695 cases in Minnesota, an increase of 45 from yesterday's report. And as I mentioned yesterday, we had a little bit of data anomaly in the days over the weekend. So today's small total represents some of the difference in timeline, and also the fact that yesterday was a very low volume testing day. But we expect to see those numbers increase further, of course, in the days to come. Sadly, we had 9 more deaths since yesterday's report. So Minnesota's current mortality total is 79. Of these 9 deaths, 6 of them were in Hennepin County, 5 persons in their 80s, 1 in their 90s, and 1 each in Dakota, Ramsey, and Wilkin counties, 1 person in their 60s, 2 in their 70s. As of today, 909 patients have been released from isolation. There are currently 177 patients in the hospital, 75 of those in intensive care. A couple of key points for today. First, an update on grant funding that the legislature made possible a month or so ago in the COVID-19 assistance, specifically to the healthcare sector. The legislature made a total of $200 million available for healthcare, including one initial $50 million fund, which we announced grants for last week. And these initial $50 million was for emergency short-term COVID funding needs, which were in anticipation of cash flow and immediate expenses that healthcare facilities were in need of. And today we are announcing the opening of the application process for the remaining $150 million for eligible applicants, which includes health care clinics, pharmacies, acute care and long-term care facilities, hospitals and health systems, and ambulance services. The application information is available on the MDH website. There's no deadline for applying for this funding, but we do anticipate many requests and recommend that folks apply as soon as possible. We're quite sure that there will not be enough funds to meet all the requests that we expect to receive, but we'll work to fund as many as we can based on an evaluation of need of the organizations, but also of the communities and the regions that they're operating in and our evolving statewide and regional priorities. I'd like to also make another mention of something we talked about on a prior call, and that is emergency dental care. In a previous briefing, we had mentioned a concern that some people were going to hospital emergency rooms or urgent care centers to receive emergency dental care. This is not ideal, both because it takes up emergency department resources that need to be focused on other issues, but it also means that the people needing dental care are mixing with those who may have COVID or other diseases. We strongly encourage all dental care providers to make necessary arrangements to provide emergency care for patients. That's entirely appropriate, even during the stay-at-home order. And nothing in that order or the executive order postponing elective surgeries should be seen as conflicting with providing that important emergency dental care. With that, I'd like to turn it over to Director Kelly.
Well, thank you, Commissioner, and good afternoon, everybody. The level of activity to support our COVID-19 mitigation and response continues to hum at a very high level. And I just want to give you a quick glimpse of what's happening in the State Emergency Operations Center today. First, we launched the public-facing dashboard, which we update as soon as any data changes. That dashboard has had more than 825,000 views on the landing page, and the case counters and county dashboards each have had more than 1 million clicks, and that tells me that that's the kind of information that Minnesotans want as we work through this issue. We continue to work with Commissioner Roberts-Davis and the Department of Administration to acquire personal protective equipment for first responders. We receive dozens of calls and emails each and every day offering products and services to help with our COVID-19 fight. We just finished another of our twice-weekly calls with all the county, tribal, and city emergency managers from across Minnesota. And right after this call, I'll meet with the Commanding General of the Mississippi Valley Division of the Army Corps of Engineers to discuss the support that his organization has provided to us as we finish up our work on the alternate care site planning effort. And those are just a few of the highlights of what's going on here each and every day. Even though many of us just celebrated Passover and Easter, and Ramadan begins in a little more than a week, we know that the virus does not take a holiday, and neither will Minnesota's Emergency Operations Center. The second day of Severe Weather Awareness Week focuses on thunderstorms, hail, and lightning, so please visit our website for more information about how to protect yourself and your loved ones from those summer weather hazards. Next is Commissioner Steve Grove with DEED. Commissioner?
Well, thank you, Director Kelly. Good afternoon, everyone. We continue to update the state on the numbers of unemployed Minnesotans who are applying for unemployment insurance, and we have a new milestone to announce today. It's not a good milestone, but wanted to let folks know that we are now up to double the number of applications that we received in all of 2019 in the last month that we've been accepting applications during this COVID-19 crisis. So in 2019, we had 219,625 active accounts for unemployment insurance. And as of yesterday, we're now up to 451,790 applications in Minnesota. So the scope and scale of this is stunning. Of course, those aren't just numbers. Those are real people who are either completely out of work or working much less than they did before. They have family to take care of and bills to pay and rent or mortgages to pay. And so we know this is a really difficult time for people, and it's why our UI team is just working around the clock to get those benefits out to deserving Minnesotans, and that includes that extra $600 per week top-off payment that came through the federal government. And I think it's important to continue to look at sort of who's most affected here and to get a glimpse into the demographics. I wanted to share that we are now up to about 14% of Minnesota's labor force that has applied for unemployment insurance. Again, that's not an unemployment statistic. It's just the percentage of the labor force that's temporarily out of work and is applying for benefits. We see about 15% of the applicants overall are under the age of 25. 21% are over the age of 55. Right now, we see that about 24.5% of those who've applied have a high school diploma or less. That's the highest percentage as it relates to educational attainment. And we continue to track the gender breakdown of unemployment insurance, where at about 45% of the current application pool is men, 55% women. So this has affected more women as of today than it has men. And I think some of the more startling disparities, of course, come down to race. Overall, about 75% of UI applications are white, which is about 12.2% of all whites in Minnesota's labor force have applied. But for people of color, the numbers are much higher. About 25.8% of people of color in Minnesota's labor force have applied for unemployment insurance. So we're aware of that, and it's that the administration is tracking closely as we move to get those benefits out as quickly as we possibly can. I want to provide some clarity around pandemic unemployment insurance, which we've talked about a couple of times on this call. This is a federal program that came out of that CARES Act in late March that kind of builds on an existing program called the Disaster Unemployment Insurance Program, which was designed to help in very acute disaster situations, you know, a flood or a tornado or something that strikes a particular geography of the country. What the federal government has done is they've expanded that program to include really the entire country through pandemic unemployment assistance. And the core idea here is to get unemployment insurance dollars to people who are not usually covered by the program. So most pressingly, this is self-employed individuals or independent contractors. Just to put into context, that program, it's essentially standing up an entirely new government program because unemployment insurance works through a set of eligibility rules, administrative guidance that the federal government gives us. It is meant, of course, first and foremost, to get people who deserve their money and prevent fraud from those who would seek to cheat the system and pull money from our trust fund when they don't deserve it. And so that becomes a challenge in standing up a new version of this program for self-employed individuals for whom deserve this money, who need to get this money quickly, but for whom we want to make sure that we are able to administer the program effectively and efficiently and maximize our trust fund and the efficiency of it. So no state in the country has yet moved publicly to begin paying out money to unemployed, self-employed individuals. But we're moving very quickly, and I think quicker than most states. We are working very closely with the Department of Revenue to build out an automated process to speed up income verification. The team's working around the clock on building a new technology platform and data sharing agreements to ensure that we can get this money out quickly while also protecting ourselves against fraud. And unlike most states, we're actually encouraging and asking that people who are self-employed do apply now. You'll get denied based on the current rules, but by having you in our system, we'll be able to more quickly get you that benefit as soon as the platform is up and running. And so we ask anybody who is self-employed or an independent contractor to apply right away and get yourself into the system, and then we will proactively reach out to you once the system is up and running. We're expecting it will be operational by the end of April. So I want to give an update on that program. We get a lot of good questions about this and want to make sure that Minnesotans understand exactly the work that's going into this and why it's important and why we're moving as quickly as we can to get this right in a way that will help more Minnesotans get help when they need it. And I should just offer as a final point on that, anyone who is eligible for these benefits will get paid backdated to the moment the CARES Act took effect. So rest assured that you will get the money you deserve when we're up and running. I also wanted to share just a quick note on our planning process for how we're working with business and labor leaders to safely reopen businesses when it becomes safe to do so. As the governor said in his executive order last week, the key message right now is to stay at home. But of course, at some point, we won't be staying at home, and people will be going back to work in a new environment. And so in an effort to make sure we're planning for that moment, the governor has asked DEED, the agency that I lead, DOLI, which is the Department of Labor and Industry, and Department of Health to start coordinating with the business community and with labor leaders to adopt the right principles and protocols we would need to make sure that reentry into our economy is done safely. And so we're talking to lots of different labor and business leaders on this through a lot of different venues. We also have a public forum It is up on mn.gov/deed/critical, and we received hundreds of submissions and ideas from business leaders there already. We continue to read every single one and categorize them so that we're learning day by day from businesses who are trying different things to engage in social distancing on site that will keep workers healthy. In the short term, the question really is, could we begin to have some workers go back to work and practice the same social distancing guidelines we've asked society to follow more broadly? And our team is just working very methodically to get a recommendation to the governor about what businesses could safely begin reopening. But above all, these decisions are going to be based on facts and science. And the last thing we want to do is extend the pandemic any longer than necessary by opening up some things too quickly and putting more people at risk. So that's the process we're engaging in, doing the right planning to give the right visibility into the situation and learn from experts about how we can open up our economy when it is safe to do so. Lastly, just wanted to continue to celebrate and acknowledge the businesses in our state who are really doing so much to improve life for people in their communities. One of our, of course, most beloved businesses in Minnesota is Hormel Foods. They have a great Spam museum that I think is known the world over as a fun destination to visit when you're in Minnesota. That museum, of course, is closed right now due to the pandemic, but the employees there have really rallied together to work with 12 different local restaurants in Austin to deliver meals on a daily basis to 300 different food insecure seniors in the area. And, of course, Hormel is being generous and paying for those meals, which helps local restaurants and, of course, helps those in need as well. So we're grateful to Hormel for being a real leader there in Austin to help those in need with food and help those restaurants find new revenue streams at a time when that's so difficult. With that, I'm going to turn it back over to the governor.
Well, thank you, Commissioners. Thank you, Commissioner Grove. I think that's a good segue. I also spent this morning talking with ag leaders about the challenges that were certainly already there from our commodity groups that are facing unprecedented hardships ahead of time in commodity prices now, some of the lack of markets. Also spoke with United Food and Commercial Workers who represent about 1,700 food processors at the JBS plant down in Worthington. And, of course, they're watching very closely the Smithfield situation. I know Bill asked about that yesterday, and I think that story has been a top story across the country because of the concerns that have happened there and then it shut down one of the nation's leading pork producers in Sioux Falls. And so we're working, and it segues with what Commissioner Grove is talking about, ways that we can look at that line down there in terms of social distancing to keep it going. These folks want to continue to work, but they have many of the same concerns that others that are on the front line can't social distance the way they need to, the PPE that they're needed, whether it's face mask, gloves, and those types of things. But I think there's ways that work, and we keep talking about it. We need to keep not only these places up, we need to get others from lessons learned. And I think there's reasons that there's some positive signs that are out there. I do think and appreciate the administration's work and Secretary Mnuchin. I think many of your listeners today, the stimulus checks arrived for people who had direct deposit, and as Commissioner Grove said, the state of Minnesota moved the $600 to take some of the immediate pressure off. But as we talked about yesterday, and as we're planning all of the things that we asked for during our just 16 days now of stay-at-home order to get the hospitals ready, it was to get ready to stand back up again on what things would look like, how we would get our testing, which we're moving full speed ahead on expanding testing to an unprecedented level. And then I'm, like everybody else, I'm following the developments that we see come out daily. We get to reevaluate where we're at. We get to change projections based on what the real world is showing us. I follow every time I see one of the studies that's out there. I read one yesterday that it said COVID-19 could carry 13 feet, which certainly puts it beyond our 6-foot social distancing, and also said could be carried on shoes. Now, one of the things is we have to validate these studies. They have to be peer-reviewed. There's a sense of urgency, but you need to get it right. Or the story that's coming out of Reykjavik, Iceland, that Iceland is going to test all of their citizens. Now, obviously, that's about 360,000, about the size of St. Paul. But the reason that it's interesting there is they're showing that 50% of their people who are testing positive had no symptoms at all. Now, that is a double-edged sword in that is very good for those people, that especially if they have immunity, they got it. they didn't get sick. It can be very bad if they're walking around and they can they can spread to others. And so these are lessons learned that we have to adapt in real time, because basically since March 13th and the full court press on this, that's the time that we have. But I can tell you that we're thinking and looking and evaluating, putting in that data, listening to it, both on the health side and on the economic side. Restaurants are going to look different. Certainly initially, if we're able to get them open, they will certainly have fewer tables. Maybe the outdoor patios are the way to go now that we're getting in. Well, hopefully by next week we'll be getting into spring. Those are the things that we're working on right now. Those are the things that I'm asking, not just these commissioners, but as Commissioner Grove said, working very closely and in tight communication with both healthcare providers and the business community. And with that, we'll be glad to take some questions.
Thank you. As a reminder, to ask a question, you will need.
You've been watching today's media briefing from Minnesota Governor Tim Walz, including the news 14% of Minnesota's labor force has applied for unemployment in just the last month. We will continue to track developments this afternoon and bring you updates as they happen on the WDIO website and mobile app, and we'll bring you the latest on WDIO News at 5. Have a good afternoon.
This has been a WDIO News special report.